Vaginal discharge is a very common issue in our clinics on a daily basis. And a lot of people have said a lot about vaginal discharge, and sometimes what they say is very confusing and makes it very complicated. In this video, I'll be putting to rest all the issues as regards vaginal discharge. Stay with me as we run on this journey. Let me start by saying that every woman has a vaginal discharge. To be precise, without a vaginal discharge, there will be a problem. Vaginal discharge is the mucus that is secreted that helps your vagina remain moist, that is, it helps it remain lubricated. It helps to clean the vagina, and it helps to prevent it from unnecessary and avoidable pain from abrasion as you walk all around your daily activities. So, it is important to state here that vaginal discharge is normal in every single woman. However, after stating this, I must tell you what the normal vaginal discharge looks like. The normal vaginal discharge is clear. It does not have any smell. Sometimes it could smell like the way your body smells, or it could smell like the way your spouse smells immediately after intercourse. Usually in about 24 hours, it usually is about a teaspoonful, of which when this smell, the volume and the color changes, it is a sign that something abnormal is happening. Stay with me and I will explain with you further what these changes will be in this video. If you want to know more about vaginal health, click the subscribe button immediately and let us go on with this discussion. Usually, some conditions can make the vaginal discharge increase in volume. Anything that irritates the vagina will increase the volume of your vaginal discharge. Sometimes, some conditions like pregnancy and diseases like diabetes mellitus can increase the volume of vaginal discharge. I must add at this point that infections, inflammations also increases vaginal discharge. Now, what does the abnormal vaginal discharge look like? Number one thing I must tell you is that when the volume of the vaginal discharge is more than I have described, then it is most likely it's abnormal. Especially when this volume is related with itching or painful intercourse, as well as abnormal smell, most likely there is trouble. You need to see your doctor immediately. Also, when the color of the vaginal discharge changes, sometimes it could be something about pink or somehow brown in just after menses. That is essentially normal. But sometimes it could be whitish like yogurt. When you see that, most likely that is a fungal vaginal infection. And most times this is usually associated with vulvar itching. When you see yellowish vaginal discharge that smells like spoiled egg, suspect that's likely a bacterial infection. With all this, you need to see your general practitioner immediately so that they could assess you completely and make a prescription for you. Causes of abnormal vaginal discharge could include any form of irritation, like when you use allergic soaps, douching. It can cause a lot of inflammation and it can lead to increase in vaginal discharge. Disease conditions like diabetes mellitus can also increase vaginal discharge. And pregnancy is a physiologic thing that increases vaginal discharge. Sometimes when you abuse antibiotics, it can lead to an increase and uncontrolled growth in the vaginal fungal flora, which can lead to vaginal candidiasis. Please note that whenever you see this vaginal discharge, it is time to get help. Seek help immediately.